Welcome, everyone. It's good to see a lot of familiar faces returning to another one of our core coffee chats. I'm Nicole Young, and I'm joined by my colleague.
Nicole Lezin. Hi, everyone.
And we have a special guest today, Holly Hughes from Behavioral Consult. And we'll let her introduce herself a little bit more when she takes over the speaking reins. But for now, some of you know we like to always start off with just a big hello. It's been a while since many of us have been able to see other people in person. So we like to do just a big wave and everybody unmute yourselves for a moment. Wave to the camera.
Hi.
Hello. Good morning. And even kisses. Yes. Okay, thank you. And if you are comfortable having your camera on, we love that, but also know that sometimes that it can affect bandwidth. So totally fine if you want to leave your camera off. We will ask everyone to keep themselves muted unless you want to ask a question or say something. Just helps minimize some of the background noise. And so I'm going to share my screen again to tell you a little bit about what we're planning to talk about today. So our topic is self-care during COVID-19, staying connected and promoting resilience for ourselves and our clients or the communities we work with. And we thought that this would be a really relevant and timely topic because we know that, and we've been feeling it ourselves, but also hearing from so many others just about this rapid pace that everyone has been maintaining for the last couple of months, both in terms of just trying to respond rapidly, adapt to changes, and it's just been this constant state of motion for many people. And so a lot of our coffee chats have focused on specific issues or topics or areas of skill building. Today, we thought it'd be great to take some time to talk about taking care of ourselves because we're in this for the long haul. This is a marathon, or I even saw recently an analogy about this being like a decathlon because there are multiple events that we have to be prepared for, and it's certainly not a sprint. And so we thought we'd talk about self-care, and we're really pleased to have Holly Hughes joining us today. And again, just as a way of some background, Nicole, Lezin, and I are two of the lead consultants or facilitators for something that's called the Collective of Results and Evidence-Based or CORE investments, which some of you might know of in terms of it being a funding model that the county and city of Santa Cruz adopted a couple years ago as a way of funding evidence-based safety net services. And over the last few years, we've really worked with a number of nonprofits and public agencies and local community groups to define CORE as much more than just a funding model and an RFP and a grant model, that it's really evolved into a broader movement to achieve equitable health and well-being in Santa Cruz County using a results-based collective impact approach that's responsive to community needs. And through a lot of input and group wordsmithing, we've arrived at this vision and mission statement for CORE, healthy, thriving, equitable opportunities, and you can see equity front and center. And that was a really important concept that emerged from the very beginning. And so when we talk about equity and equitable health and well-being, we're talking about creating and ensuring that there are equitable opportunities for people to experience these 8 interconnected core conditions for health and well-being across the lifespan and throughout our county. And that we can't talk about health and wellness without also talking about what it takes to ensure economic security and mobility and how that's related to living in a safe and just community that's healthy environments, both indoors and outdoors. And so all of these things really are connected. And so our coffee chats and last week's longer core conversation on race equity and COVID-19 really are opportunities to take a look at what's happening in each of these core conditions, some of the great work happening in our community. But we want to constantly be pushing the question or the envelope around how do we do things more or differently or better in terms of creating those strong connections between these core conditions. And when we think about some of the innovative and creative responses to COVID-19 that we've been hearing about. How do we make those permanent and lasting so that we are making strides towards that vision of equitable health and well-being? So that's all I will say about CORE. And I think at this point, I'm turning it over to Nicole Lezin.
Thanks, Nicole. Just want to extend a warm welcome to Holly Hughes and our gratitude for her taking the time to join us today. Some of you already know Holly from her work with the community health centers. She's an experienced behavioral health expert in our community, has worked with individual clients and teams, and is now expanding her work outside of our county statewide. So we're very, very happy to have her sharing her insights about these topics with us today. And if you'll keep your questions coming to us through the chat, we'll do our best to forward those to Holly. We'll have a couple of opportunities to field those, but for now, I just want to turn things over to Holly. Thanks.
Thank you. It's a real pleasure to be with you all today. And I think more than anything, just having us all think about the idea of connecting around these topics, makes the most sense, as opposed to just me sharing ideas with you, from me to you, much more so just a collective experience for all of us to share how we're doing, what's working, what's been challenging, and maybe hopefully to come away with a couple of new and fresh concepts that we can carry forward. So you can see that we're going to focus on staying connected to one another, to our patients and clients. This is a webinar that I actually shared with some in the healthcare setting a couple of weeks ago. And so some of the language is connected to care providers who are in the healthcare setting, but hopefully it can be transferred out to all of our work, not just with our professional selves, but our friends and family as well. And then we're going to just transition after we break out and share some ideas together. We're going to talk a little bit about resilience, hopefully in a little bit of a new way. Okay. So there's a couple of different narratives out there that so from our current leadership even that about this being a fight and a war. And while that's not entirely inaccurate, there are a lot of similarities with what we're experiencing right now and a fight or a war. There are also quite a few things that are dissimilar to that. And some of them are listed here on the slide. And so I think some of the experts that I've really been resonating with, and when I see kind of how the narratives that they're putting out there, it tends to sit a little bit better with me to be thinking about this in terms of adaptation and how can we respond and not react. The really clear importance of sharing resources and actually increasing connection and community. And those are the things that are very different than an actual war that's happening in the fighting zone. So this is just an invitation to be thinking about when we hear that kind of narrative, maybe balancing it out a little bit with some of these other thoughts. One of the things that I just came across this morning from a high school senior who is having to adapt to creative ways to experience graduation, he was quoted in the San Francisco Chronicle just saying, there's no one to be angry with. I'm just wanting to move forward and hope things get better. So it's kind of an example of that forward motion and hope rather than the blame narrative. Okay, the next slide. So we all have been experiencing situations where really well-intentioned friends, family, colleagues are sharing ideas and thoughts with us that maybe aren't landing so well. And so we thought we would just ask you to chat in if you've had any experiences like this, where again, someone with really good intentions shares something that just didn't quite fit with how you're experiencing the changes that we're all in the midst of. One example, again, I just came across recently, is I was looking at this NPR post on social media that was sharing some really actually pretty interesting tips about how we might think about tracking how we're spending our time and then making adaptations based on that tracking. And one of the comments that came through, I'm just gonna read it to you, said, the very first comment said, applies to everyone but full-time moms with 0 breaks. So those kinds of examples, right? Like anything like that you're all experiencing.
Thanks, Allison, for getting us started.
Nicole, do you mind reading that out? I'm not really able
sure.
to track that chat.
So,
yeah.
So Allison's contribution was, somebody said, my kids and I are creating an illustrated children's book. So there's a lot of things that come across as sharing an activity, but feel like a humble brag or worse. My Facebook feed is all death or bread, pretty much the 2 choices. Those are great. Thanks. Keep them coming.
Yes.
If you have something that is not landing quite right with you, but may have been well-intentioned, feel free to share it in the chat. So here's another one, just the notion that we all have to be more productive right now. Like we all should be starting tons of home projects or self-improvement. Definitely hear that one. Lots of shoulds out there.
Yeah, that's a great example of just how even prior to the pandemic, this is a concept that we're all managing. Just the notion that just the pressure, to be doing something different than what we are doing, and then how especially in our Western minds and our Western culture, just kind of how that pressure manifests into stress. It's rarely serving us to be thinking about the shoulds.
Nicole had someone share some conspiracy theories.
Yeah,
they're always hard to respond to.
Yeah, there actually is some really impressive research that I can send out through Nicole and Nicole, if anyone's interested, about shared trauma. And one of the aspects of shared trauma as a concept is that when our trauma narrative doesn't match someone else's trauma narrative, all kinds of emotional things can start to happen. And if we're in a position where we're offering care to others, or we're in a team setting where we're needing to show up and stay connected with someone whose trauma narrative is very different from ours, there's a whole set of helpful tips around that we're not going to get into today, but I can definitely send out if people are interested.
That would be great. And just a reminder, we're recording this, so people who might find that kind of thing helpful and don't have a chance to join us live can watch this later and have access to all those resources as well. So another comment from Anastasia was about the quarantine 15 weight gain and being ashamed about that. It's tied to all the sourdough bread we're all eating. People who comment, who draw conclusions about hospitals being empty, not as a success story that we've actually flattened the curve, but just as drawing a conclusion that means that we don't have to keep doing what we're doing. A retired family member saying, at least you have work and school and kids to keep you busy, and I've got nothing to do. So, understandable, but something where somebody has no to-do list, being jealous of somebody who feels actually swamped and drowning with a to-do list and hard to understand the other perspective. Another suggestion here is when your anxiety is being dismissed, if you and your family are healthy and you're working, what on earth do you have to be anxious about? That's not how it's experienced usually. If you're already working from home, so not much change for you, right? I've heard that. And to a certain extent, it's true. On the other hand, there are some real differences. Extreme emotions of all kinds, silliness, sadness, anger, overproductivity, almost like a mania. Extreme emotion coming my way and my own as well. Trying to always remember to breathe before reacting. Always good advice, pandemic or no.
Yes, those are all really poignant examples that I hope you hold in mind as we move forward to kind of talk about some of the tips and some of the suggestions, because as we are illustrating, the most important thing is that you only take in and on what fits, and everything else at this point really just kind of let it roll on off. So on this next slide, we have just some specific suggestions and concepts, some of which are very common. Others are a little bit specific to thinking when it comes to how we want to interact with our colleagues professionally. And these tips came from Elizabeth Morrison, who's a behavioral health consultant who has done a lot of local work here in Santa Cruz. And her website is at the end of the slide deck. And on that website, there are a lot of resources, and including this tip sheet that has quite a bit more detail on it than I'm going to go into. But these are just some ideas about how can we connect a little bit more effectively with one another during this time. So one technique that we can all try or keep doing is to use self-disclosure. This is especially effective when we saw some examples of there are extreme emotions happening right now for many of us. And so to model that is can be really helpful in opening up the safety for people to talk about how they're doing. So just some examples of that, like I haven't slept well for the past week because I'm worrying so much. One of my family members is in a care home and I'm not able to see them, and really struggling with the loneliness and feelings around that. It's also helpful to narrate the process before you self-disclose, like just saying I'm torn about sharing this information, but I've made the decision to go forward because early on I made the decision to share with people that I am prone to mild depression when I don't have a really, really busy schedule. And I have managed to set my life up in such a way that I do really well with that until I didn't have control of that. And then the anticipation of the depression coming was worse than the actual dip in mood that I experienced. And now things have plateaued a bit because of various things. But I do think, just like that, it's okay and actually helpful sometimes to just talk about the kinds of things that maybe we might be reluctant to share. Acknowledging loss, like instead of just bypassing when someone shares a loss. And remember, we all know loss right now runs the gamut, from, as I mentioned, like rituals like graduations, weddings, all the way, to death. So there's a big spectrum of loss, and how are we staying connected in that? One way to do that is to be sure that we're acknowledging it. Making meaning, not in a trite way, right? But just sense making. How can we be making sense of this without doing that silver lining? It's a really tricky balance to strike. One way to do that is to kind of tune in to the feelings inside, do some self-disclosure, and then also have some meaning that you know, I know that these challenges actually bring us closer together, or finding examples of things that are working well for you and sharing that from using I statements, right? Not assuming that that's something that other people will also be relating to. And then focusing on strengths. Compliments are very helpful, authentic compliments. And sometimes they are not, we have to practice receiving those compliments too, like pausing, accepting it, and kind of reflecting back, wow, thank you, I appreciate that you saw that in me. Especially with staff and team, to be able to just really point out people's strengths and comment on those. And then there's this concept of observer expectancy effect, which is really simply just when we as leaders or supervisors can call out something that we've observed in the past and then talk about what we would expect as a result of that. I think about teachers when I think about this, how much adaptation teachers have had to do their entire careers, right? And so it would be a way of just collegially saying, oh, you know, remember when we had to do that and we managed to get through it in this way? I know that we can also, you know, call upon those resources and make this happen. It's another example of this concept is really just even saying, I'm going to take action and set up a committee, or you know, have a town hall, have something really intentional where we can address this, make a plan, focus on how we're going to move forward. So the next slide is this is our lead in to the breakout room. And I'm just going to leave this up for just a minute while I share a little bit about how we're going to do the breakouts. These are questions that will show up in your breakout room, and we're hoping that these will not be facilitated, so we're just hoping that you take the time to share with one another what are some of the challenges that you've been experiencing, and then what are some things that you have tried that have worked. And we have a 12 minutes together in the breakout room, so that time might go a little bit quickly. So please feel free to just take time and try to manage having everybody get a chance to share. And then we'll see you back here in real soon. Hi, everybody. I just had a really pleasant breakout with just one other person that felt just nurturing in and of itself, just to chat together about what some of the challenges have been and what some of the things that have been working. We had some similarities and could relate to each other. So I'd love to just kind of open it up to either chat, or if you want to raise your hand and share verbally just about anything that stood out to you from that time together. Any takeaways?
Holly, our little group talked a lot about the importance of routines and how there was a transition period to figuring that out, but just, you know, the different pace and rhythm and just some different ideas for either blocking off time to switch between work and kids, or just getting a little bit more settled instead of having a lot of interruptions and switching back and forth.
Yeah, thanks for that. I think for me, that helped me to go from kind of like no lines between work and my parenting and my cooking and my laundry to starting to add structure. And then I also know for others, the flexibility has been really important. Like some of the recommendations about really having structured time don't work for like young moms with young kids, for example. So some, moms with young kids, it's like that notion of even trying to structure the time is laughable. It's more just like, oh, I need to be fluid. And so I think it's really helpful to be thinking about what feels the most helpful, to you. But in general, I think structure can be a helpful thing for humans to just kind of have a easier time with some of the mood things that can come up. We'll take a couple more comments. If anybody else had anything that really stood out to them or surprised you, or something that you're going to try that you maybe hadn't tried before.
Hi, I'll share. I was reminded of how powerful it is to have human connections at all times, but especially during times of isolation or shelter in grace. And even though I've never met the women I was in the breakout room with, the connection was genuine and heartfelt. And we had some great tips we shared with each other. And it was just so wonderful to have human moments. And I do believe that Francie shared that right now she's had to shrink her world to focus on what's in front of her, just her immediate concern. And I found that very helpful because I'm part of a lot of conversations that are centered around very serious issues and challenges around in what's happening in our community right now. Sometimes it could get very overwhelmed and very overwhelming. So it's just a great reminder for me too that even though it's very cliche to say, let's be mindful, have self-compassion, but to really actually remember that being mindful and charity begins at home. So really to start focusing on myself and centering myself before I can show up for others, right? So just to just focus on one thing at a time, one day at a time, 1 hour at a time.
Yeah, that's so beautiful and well said, and what a perfect segue to what we're going to talk about next together. I said the same thing in my breakout, just how meaningful it is to actually connect with one another. When I see even webinars like this, or I'll see an article, by Jack Kornfield or something, they're not always landing quite as effectively as when I just kind of pause and check in with somebody like we just did. So I would say if there are ways for us to continue to do that, let's keep that in mind. So this next piece is really focused from a healthcare setting perspective, but in general, a lot of what we just talked about together, there's some things we can relate to with some of these tips. This idea, that second bullet there of setting up regular days and times to connect, that point was actually created for a group of case managers who are used to having being available to their clients at all times without having much structure. And so talking about how, because of the changes that have been happening and because of our obligations now at home and work, that it might be helpful to add structure. And so that came up for all of us, right? Is that maybe this idea of a little bit more structure to our day. These new and creative solutions, what we're doing right now is an example of that, what y'all have been doing over the last several weeks, gathering like this. I know this is one of many supportive networks. One of the things I've been most impressed by is the substance use disorder AA and NA adaptation. I don't know if anybody's familiar with how that has gone, but it was a really rapid transformation from in-person meetings to everything being offered online, and just kind of how impressive it is that how we can adapt. And also, it's not perfect. There are people who don't have access to those meetings that we, in the healthcare profession, looking at how are we going to address those gaps. But at the same time, it's just really impressive to see all the examples of new and creative solutions that are happening in our community. And we'll talk a little bit more about that in the next little bit here. So we can go to the next slide. So this concept of resilience is overstated, overused, and also still really, really meaningful and powerful when we apply it. And so the concept that I wanted to share with you all and invite you to be thinking about might not be a brand new one to all of us, but it's been a helpful way for me to be thinking about resilience. And that is that resilience is not a quality that you just have or don't have. Of course, there's lots of research on resilience and what kind of leads to resilience and what contributes to people being less resilient. So that's all valid, of course. And this concept of there's a pathway to resilience. There's an intention toward resilience, rather than it just like coming upon me, or I have it or I don't have it. This is there's a similar kind of parallel when we think about empathy, when we're trying to connect with other people. And sometimes people will just say like, I don't have empathy. It's not coming to me, instead of thinking of it as a choice that we choose to step into someone else's shoes, to shift our perspective, to be generous in our thinking, right? These are all active things that we do to lead us toward empathy. And there's some similar things to be thinking about when it comes to resilience. And so just kind of to break it into 3 different ways of thinking about it, we've got how can we be personally resilient? And then we're going to do a really quick exercise that is about team resilience and being more connected to our values. And then we're just going to talk for a moment about just that community resilience. So when it comes to personal resilience, mindfulness has already been mentioned. And what I'd love to offer for you to be thinking about, we're going to watch a video in a few moments here. It's a really simple animation about mindfulness. And it's just a reminder that no one can tell us what we need to move toward resilience except us. And the only way for us to know is to practice something like this. We're going to watch it in a few minutes. So your therapist can't tell you what you need. Your partner can't tell you what you need. Your children can't tell you what you need. You might need a nap. You might need a popsicle. You might need to do some yoga, go gardening, right? But we have to tune in and listen in, pause, pay attention, and then there's a knowing there. And so this is a sweet video that kind of helps us get from this chaotic mind state into something a bit more focused.
Training the mind is often quite different to how people imagine it to be. Maybe they have an idea it's about stopping thoughts or eliminating feelings, but the reality is a bit different. An easy way to think of it is to imagine yourself sitting on the side of a busy road, the passing cars representing the thoughts and the feelings. All you have to do is to sit there and watch the cars. Sounds easy, right? But what usually happens is that we feel a bit unsettled by the movement of the traffic. So we run out into the road and try and stop the cars, or maybe even chase after a few, forgetting that the idea was to just sit here. And of course, all of this running around only adds to the feeling of restlessness in the mind. So training the mind is about changing our relationship with the passing thoughts and feelings, learning how to view them with a little more perspective. And when we do this, we naturally find a place of calm. Will we sometimes forget the idea of the exercise and become distracted? Of course we will. But as soon as we remember, here we are, back on the side of the road again, just watching the traffic go by, perfectly at ease in both body and mind.
And so similarly, to that one skill, right, of staying grounded, staying tuned in, there's another pathway that gets us there, which many of us are familiar with, and many of us have participated in exercises like this. But another way to get there is to be focusing on our values. And so the next slide that you're going to see is really created for teams. So you could bring this back to your teams if you're working professionally on a team. And one thing to keep in mind anytime we look at a values exercise is that values change for all of us at any given moment. So we're going to participate in something where we're selecting a value that really resonates with us right now. And you don't need to overthink that, because you might be, if it was, Thursday, you might select a completely different value. But the way to get in touch with this exercise today is just to allow yourself to select one of the values that is standing out to you the most. And we're going to ask that you go ahead and on the poll that you see, that you just kind of select one that is really standing out to you right now today. So we have empathy, compassion, being responsive and supportive to the needs of others as well as one's own needs, creating or contributing to something larger than oneself, trust, openness, personal growth, and being in mutually supportive and caring relationships, career and creating products that provide value to others, and then politics, including campaigning for justice and human rights.
So Holly, we've had a little over half of the participants vote, now 3/4. So I'll leave it open for maybe another 30 seconds or so.
Okay, and before, you feel free to just show those results when they're ready, Nicole. As we wait to see, this could go in any direction, right? Because it does every time we do a values exercise with a group of people, you never know where it's going to head. But one thing I can share with you is that, and there are the results. It looks like there's quite a blend of what people chose. This one, being responsive and supportive to the needs of others as well as one's own needs, this came up pretty highly resonant with the last group that we did too, and kind of makes sense thinking about everything that we have going on right now and everything we've just been talking about, right? How to be mindful of self and keep others in mind as well. So the takeaway here, one suggestion would be that you take the value that really resonated with you and you put it on a Post-it note or in your journal or on your bathroom mirror, and you just use it to ground when things feel chaotic, when we feel like we're scatterbrained, just to kind of focus in on a value can feel really grounding. And then the last piece that we're going to just briefly touch on is just this more broad perspective, which actually I feel like Nicole spoke eloquently about in the very beginning when we are thinking about core. It's that concept, right? Like, how can we sustain the positive aspects? Like, for one, in healthcare access, the no-show rates for mental health visits have gone from an average of 30 to 40% to less than 10% based on phone. People not having to take a whole day off work to travel to get to their mental health appointment in the middle of the day, 2 o'clock, right? That's really just one little example of how can we carry these community changes forward so that we can continue to have positive impacts. And I think that's it for my part. These are some resources. There's the that first link is for the animation that we saw. That Headspace app is offering free subscriptions to medical providers, and I'm not sure how they're defining medical providers, but something we wanted to make sure you knew about. Greater Good Berkeley is just something that many of you, I'm sure, are familiar with that website, where I just get a lot of my what I share is rooted in some of the things that are on that website and all the research there. And then that Our Source website is the one I mentioned that Elizabeth Morrison has a lot of empathy and connecting tips on.
Thanks so much, Holly. Authentic compliment. That was great.
You're welcome. My pleasure.
Thanks for receiving that. We really appreciate your time with us. And I know I speak for all of us, and it was just great to have some chance to reflect. Everybody's been dealing with so much, and they're different ways of dealing with things. And you've just given us so many ways to think about both the individual day-to-day experience and this larger perspective as well for the community. And for those of us who are embedded in different teams, just some different ways to share this information. So as always, we've recorded this. So those of you who might have colleagues who would like to hear some of this content, please keep an eye out for a follow-up email and our core YouTube channel, which has all of our chats on it. We are going to have a feedback survey link in the chat. There it is from Nicole. You can also help us out by filling out the feedback survey, because we draw our ideas about future topics and ways to structure these chats from those surveys. We pay a lot of attention to them, so please do fill those out. Tomorrow, we'll have another session on the payroll protection loans that got funded and what to do from that point forward. This is co-sponsored with the City of Capitola and is geared more to the business community, but nonprofits are welcome to listen in as well. And then we don't have our topic for next week set yet, but keep an eye out for that. All of the core documents, resources, webinars, etc., are on this shared Google folder that you see here. And then I'm going to put a couple more links into the chat with some convenings that are coming up this week. On Thursday, the Health Improvement Partnership's annual forum is featuring Tony Iton, who is an incredible speaker, and he's going to be talking about the social determinants of health, and our own Keisha Browder is going to be doing the Q&A with him. So I think that will be a great event. If you want to follow the link in the chat here, I'll put it in here so you can register for that. And then another event is the Continuity of Connection that's supporting behavioral health and wellness for children, youth, and families. So that's the Behavioral Health Initiative through the schools. So that link is up here too. That's also on Thursday. So Thursday's a big day for behavioral health and social determinants of health. So thanks again to everyone for joining us. If you have any last questions or comments for us in the chat, Holly and the two Nicoles will be hanging out for a couple minutes here. So feel free to share those. But otherwise, we'll look forward to seeing you very soon, and please take good care, and thanks for joining.
Thank you, Holly, for being here today. Thanks everyone for joining us.